Welcome to the Congress Agorà 2022. We are here with Dr. Giuseppe Scarcella. Good morning, Dr. Scarcella. Let's start. What are the innovative contents, the confirmation that you want to highlight regarding your participation at the Congress?
So my session this afternoon, we will talk about dermoscopy. So the dermoscopy, it's an approach for diagnosis of the most common skin tumors. But we will talk about also hair disease, and then the dermoscopy for hair disease in trichoscopy. And lastly, the use of dermoscopy in the laser practice, laser dermatologist, laser surgery. So in this field here is very important because you could be able to improve your diagnosis and also to improve the results of laser treatment, because with dermoscopy you can find the end point of the treatment quickly, and so you can have better results on using less fluences and maybe less session, why not? And on using less fluences, so the patient can feel less pain, and you can improve your results with this approach.
Very interesting. As for your experience, are there any specific recommendations for your colleagues?
Absolutely. So when a colleague starts to treat some skin lesion, it's very important to make a right diagnosis. So if you burn, if you destroy some lesion, you must be sure what lesion are you destroying. Then it's very important to choose the right lesion. And if dermoscopy can help you to make a diagnosis, so you are sure that you can destroy this lesion. And in trichoscopy, the last years, in some disease, we are quite able to avoid skin biopsy, so to avoid a more invasive approach to reach a diagnosis, because with dermoscopy you can be sure that the diagnosis is that, and it's not absolutely non-invasive approach. And the same when you use the laser in this field. I said before, it's a very helpful approach to utilize the dermoscopy in a laser practice, in laser dermatologic and aesthetic medicine practice.
And it is very safe for the patient too.
Yes, I agree. Yeah.
The aesthetic medicine is becoming more safer and ethical. Are there any clinical findings and recommendations for patients?
So the patient must be clever. And the patients firstly must follow the recommendation of the clinician, because the right recommendation are useful to reach the better results. And also the patients, it's better if the patients also has the treatment about colleague that had experience in this field, that has a right experience, so the results will be better in this field.
Skin cancer is by far the most common type of cancer. Which skin cancer is the most dangerous?
Absolutely, the most dangerous is the melanoma. So the melanoma, we can have melanoma originated from nevi, but not only nevi, because the melanoma in the 70% of cases can originate from skin without nevus. Why the melanoma is so dangerous? Because the melanoma is one of the few malignant tumors that can affect also young people. People of the third or fourth age, and in this case there could be more dramatical. The exitus could be more dramatical if are young peoples.
Thank you, Dr. Scarcella, for your important contribution, and have a nice day.
Thank you to you. It was nice to meet you, and
For me too.
good job.
Thank you.